Good morning. It's a privilege to be a part of the 7th Ideal Village Conference organized by Stanford, BHU and the Wheels Global Foundation. I wish I could have been with you in person, but regardless, it is my privilege to be with you on this VC. As you already know, there is a very ambitious set of programs going on in India even as we speak. These are towards the achievement of the SDG 6, which talks about providing access to safe water and sanitation to all. We are in the midst of implementing the Jeevan mission, which aims to provide functional household tap connections to each and every rural household, over 19 crore of them, within a short span of 5 years, and therefore the ambition to achieve this by 2024. And remember that we were at a starting base of less than 3.25 crores as on 15th August 2019, when the Prime Minister announced this mission from the ramparts of the Red Fort. There is a lot of, as we know, political will behind this effort, both at the national and the state governments. We know that funding has been made available. The estimation was that there would be a requirement of 3.6 lakh crore rupees, and that amount has been provisioned by the Government of India as well as the states and UTs. There is also an effort to ensure that the program actually achieves its objectives and sustains over time through partnerships with academia, with civil society organizations, such as those present in this conference today, and also an effort to engage with the public through Jan Bhagidari, so that village communities in particular and women also as a very important part of that village community are a part of this effort right from the planning stage to implementation and then on to the operation and maintenance. We have had the privilege of getting water reach over 10.4 crore rural households by now. And as we also know, this is on top of a similar massive effort that was carried out in the country between 2014 and 19 to ensure access to toilets for all, and every village declared itself open defecation free. And now we are going beyond that and trying to achieve a comprehensive solid and liquid waste management and comprehensive rural sanitation in every village under the Swachh Bharat Mission Gramin Phase 2. Similarly, showing high political will, high public spending as per requirement, availability of financial resources, and also building on partnerships and on Jan Bhagidari. Even as we make efforts to provide water through tap connections to every rural household, we are acutely conscious of the fact that that water must be of the appropriate quality, because we know the impact of clean drinking water on health, and in fact we have the finding of Professor Michael Kramer suggesting that global studies, including in India, have shown that the provision of clean drinking water alone can reduce infant mortality by as much as 25%. So for the health of our people, especially the children, for preventing the poverty that is the outcome of disease, and for ensuring that every individual can continue to carry out their economic activities or other go to school, etc., we have to make sure that quality is sustained. There is, as you know, a massive effort under Jal Jeevan Mission to ensure that, while on the one hand there is this whole network of laboratories, water testing labs that have been set up all over the country. We require them to be NABL accredited, and they are getting accredited in very large numbers. On the other hand, in order to ensure that the message of quality reaches every village, there is the concept of the field testing kits. FTKs are provided to each and every village, and villagers, especially women, are trained how to use them. Well over 13 lakh women have by now been trained all over the country, and the effort is that they should then be checking to make sure that the water they are getting is of the correct quality, and that should also build the confidence to be able to drink from the tap. So that's one major effort under Jal Jeevan mission. And of course, going forward, the challenge will be to ensure that the assets that are created, and as we know, having spent 3.6 lakh crore, there will be very sizable assets created for the rural pipe water supply schemes. These assets must not only be seen as assets belonging to and for the community, they should also be operated and maintained by the community. Therefore, our suggestion to the states constantly reinforced that they must look at handing over operation and maintenance to the local communities, including through the village water and sanitation committees, perhaps the women's self-help groups who, anecdotal evidence suggests, are bringing in very effective ways of collecting user charges and ensuring that the schemes run regularly, and the water that we wish should become available, at least 55 LPCD is the JJM norm, and that water must be available day after day at the predetermined hours. The other big challenge, of course, is to ensure sustainability. So we know that water is a very precious resource. We know that India, based on its share in the world's population, doesn't have a commensurate share in the water available for use. We know that there are very large demands that agriculture and other economic activities place, which are growing as the economy grows, as the population grows, and we have to therefore ensure that everywhere in the country, including and especially in the water stressed areas, the water supply that is being provided, whether it is based on groundwater schemes or on surface water, those sources of water must be sustained over time. So whether it's a recharge of the groundwater sources, or ensuring that springs, etc., if they are used, are also recharged, we have to take care and make sure that our sources A, remain clean, B, sustain over the years, and this to be done in a situation where we know that the whole climate change issue poses a very substantial risk. So ensuring resilience in the face of global warming, and making sure that we are able to live up to our promise to our people that we will be able to give them, we will give them potable drinking water of the quality, quantity and regularity that they expect, and that we will continue to do so year after year. Huge task, mammoth challenge, and we look forward to the support, the engagement of civil society and academia in making these a reality. So it couldn't be a more opportune moment for the ideal village to be discussed by a group such as yours. We believe that the active engagement of academia, knowledge partners and civil society leadership will be critical for achieving the goals that we have set ourselves. And the work that you all are doing, I know Gauri ma'am has been putting in a lot of energy into working on spring rejuvenation in areas that need such efforts. And these localized solutions to problems that we are aware of And we know that there could be very expensive, highly engineered solutions, but solutions that are locally possible, feasible, realistic, cost effective, and owned by the community and sustained over time are really the kind of solutions we are looking for. So my compliments to the team, my gratitude to them for the great work they are doing. I hope that the work that you are doing here, Gauri ma'am, is going to reflect in a lot of other areas of the country as well, and we will see much more civil society leadership coming up and much more interest from academia going forward in order to make these ambitious efforts to achieve rural water and sanitation to every rural household a reality. Thank you. Good wishes for this conference.
हर घर जल, जल जीवन मिशन।